disease experts. It comes with a plea for a statewide mask mandate. News 2's Eric Egan joins us live tonight with a look at that letter. Eric?
Hi, Bob. Yeah, this letter, in fact, it opens with, as I write this, the number of active COVID cases in Tennessee has risen by 11% in just the last 2 weeks. Dr. James Hildreth, the president of Meharry Medical College, well, he pulled no punches in this letter to Governor Lee. Hildreth warns the governor. We're about to see a surge in COVID deaths, which we have, by the way. It's been the deadliest week since the pandemic. Hildreth is telling Lee, our health is in his hands. 60% of the state's coronavirus cases have come in the last month, and Hildreth believes more will follow without a statewide mask mandate. Now, Hildreth does commend Lee on testing, but he points to a recent transmission rate drop in Nashville, attributes that to a mask mandate, and pleads with Lee to take similar action. Now, we know this. Lee has said repeatedly he will not be issuing a statewide mandate. In fact, essentially saying again from Lee that people cannot be forced to wear them. Bob, back to you.
You're right. The governor has not been a fan. Thanks, Eric. 2,400 new cases of COVID-19 reported in Tennessee in the last 24 hours. Also, 39 additional deaths, 81 new hospitalizations today. The total number of coronavirus cases for Tennessee inches closer to 119,000. For weeks now, parents have worried about COVID-19 risk if they choose to send their child back to the classroom. It's not an easy decision, but doctors tell News 2's CB Cotton monitoring your child is key.
The way kids once made their way to school, learned at school, and even played at school will be different this year. COVID-19 has changed everything and left parents with a variety of opinions.
To do what's best for the kids.
Neither option is okay.
And a singular worry. How can we prevent children from getting COVID-19? On Wednesday, health officials in West Tennessee confirmed a 6-year-old that died unexpectedly tested positive for COVID-19 after her death. Her mom has written about her daughter in public Facebook post, saying they're waiting to learn more. What are some of the symptoms that present more severe in children who get diagnosed with COVID-19?
Children who are infected with COVID-19 or with SARS-2 virus are generally less ill than adults.
And some of those children may have no symptoms at all, according to Dr. Catherine Edwards from Vanderbilt Children's Hospital. She says of the children who get sick, only a few develop worsening conditions.
A very, very small number of children that have an inflammatory condition that occurs 2 to 4 weeks after the illness, and that is called MISC, multisystem inflammatory syndrome in children.
And when that happens,
they present as very tired, very lethargic, very poorly able to do things. And if indeed, and they often will have high fever.
And while MISC is rare, Edwards says once it occurs, children should be seen by a doctor immediately.
They will be given support for their blood pressure. They will be given fluids. They will